U.S. Commerce Department recently named, this United States Commerce Department recently named 4 organizations in this country, just 4, as recipients of this year's Malcolm Baldrige National Quality Award. That's the nation's highest presidential honor for performance of excellence. This came from the United States Commerce Department, just 4 awarded, and one of them went to the Charleston Area Medical Center. According to the U.S. Commerce Department, for the past 2 years, CAMC has ranked in the top 5% for quality inpatient service by Health Grades, a national service that rates the performance of physicians, hospitals, and healthcare providers, and received the group's Distinguished Hospital Award. Dave Ramsey is president and CEO of CAMC, joins us on Metro News Talkline. Dave, good morning. Congratulations.
Hey, good morning.
Congratulations. That's pretty cool.
Well, yeah, we're very excited around here.
Yeah. How did you do that? Or how did your people do that?
Well, exactly right. It's all about the team. We started 10 years ago. Actually, next month it'll be 10 years, recognizing that we wanted to be the best possible organization, not just from a quality standpoint. We've always had great quality, but as an employer, as a resource to the community, really all aspects of the hospital's operation and functions. And the Baldrige criteria, as we call it, was a way for us to begin to benchmark amongst the best hospitals in the country.
Did you look at the criteria initially and go, wow, that's a lot. I don't think we can do that.
Well, that's pretty much was our reaction initially. We began with education of our management team here, department managers and others, and I think all of our mouths were open when it first started. Mm-hmm. But we sort of broke it down into pieces, and over this 10 years, we've improved every year.
Yeah, well, you have to. I mean, if you don't, in business, like a lot of things, if you're not getting better, you're slipping behind. So you have to strive to get better all the time.
Well, absolutely. I mean, it's like anything else. How well we learn and adapt and improve will determine, the future of any organization.
Mm-hmm. Dave Ramsey is with us, president and CEO of CAMC, and they have just received, just a couple of days ago, the U.S. Commerce Department's Baldrige National Quality Award, one of 4 given out, and CAMC gets one of them. When people go, I'm going to make a wild generalization. Most people don't want to go to the hospital, right? Unless you're going there like, okay, something's got to be done. You're going to feel better when it's over. So how do you make patient satisfaction? How do you get that up to a point where people say, oh, that wasn't that bad? How do you do that?
Well, it's a patient by patient experience, and that's our challenge. A lot of our patients come from outside the immediate area, and they may have never been to Charleston, mm-hmm. and they certainly have not been to a hospital as large as Charleston Area Medical Center. So we've worked diligently, really, with all of our departments and all of our employees, just to sensitize everybody to the fact that we have to treat everybody that comes in the hospital with respect, and we need to be answer their questions and be courteous to them as well as their family members and anyone that comes in with them.
Yeah. Dave Ramsey is with us, president and CEO of Charleston Area Medical Center, and they've received a prestigious national award from the U.S. Commerce Department. Let me ask you about a couple of things in healthcare right now, because
Sure.
The Obamacare law in place for a couple of years now, obviously a lot of adjustment. Generally, how is that affecting CAMC?
Well, the good news is that, I think, it's pretty common knowledge now that about 180,000 additional people received insurance coverage through Medicaid and the CHIP, Children's Health Insurance Plan, which is a great thing for everybody. So lots more people insured in our state than in the past, and that part's going very well. For those of us in healthcare, especially hospitals, the difficulty is that Medicaid, as well as Medicare, of course, Medicaid's a program for the poor, and Medicare is the plan for individuals over 65 years of age. Well, they both pay below cost. And in a state where we have lots of, unfortunately, a large number of Medicaid recipients and a large number of Medicare recipients, the challenge for us is how do we continue to lower our costs to be able to operate
Okay, so Dave, you got a lower cost, but also you got all these new Medicaid patients. Of course, the argument would be from Obamacare folks is, well, wait a minute, they're on Medicare, you're getting something, and there used to be charity care, or I guess you got some reimbursement from the federal government from that, but aren't you getting at least more in Medicare reimbursement than you got in unreimbursable care historically, or are you?
Well, we did, but the moving aspect of this is that as the concept was, we'll insure everybody in our nation, and then you're not going to need all this additional reimbursement from Medicare. So we've seen more reimbursement for patients that were previously uninsured, charity care or bad debt, but Medicare at the same time has cut $60 million out of reimbursement over the past 5 years, and there's another in our just CAMC. $377 million total. That's cumulative from 2016 to 2024. So yes, we've improved our reimbursement, and that improvement from Medicaid has helped make up for the losses in the Medicare cuts to date. But the Medicare cuts keep going forward, and those cuts with the formation of the Affordable Care Act were put in place to fund a big proportion of the $1 trillion cost of the Affordable Care Act.
Right. So that tells me that unless you find ways to save millions and millions of dollars, which I'm not sure how you're going to do that, then you're going to have a lot more cost shifting.
Well, exactly. And I think that's a huge issue and concern that what we've dealt with in West Virginia for a long time. Unlike many other states, where you have county hospitals or city hospitals or even state hospitals that are supported by tax dollars, we don't have that in West Virginia. So there's been a hidden tax on the business community that offered insurance through the cost shift on those businesses to help make up for care of the uninsured and the charity population because there's no tax support for that.
So Dave, is all this working, or is it a house of cards?
Well, that's a great question. I'm not sure I'm smart enough to be able to.
Well, you better be, because you guys, it's all coming back your way. I mean. Yeah,
we'll have to figure it out locally, and we're confident we will figure it out here. And I think all hospitals across the country are in the same predicament. Most hospitals, about 5,000 hospitals in the country, and most of those are in rural communities and are small hospitals. Mm-hmm. So we're all struggling with the same dynamic, and there will have to be a national solution to this concern that we all have.
Dave Ramsey is with us, president and CEO of Charleston Area Medical Center. Dave, I understand too that with of course, federal Medicare would be a huge federal program. Medicaid is a huge state program, probably has federal implications as well. And with that becomes a significant regulatory burden. How much additional regulations are put upon hospitals, CAMC in this case, to provide Medicare coverage, and how do you keep up with all that?
Well, it takes dozens and dozens of processes and systems in the organization to just stay on top. The number of changes, frankly, that are happening just daily are virtually overwhelming. We get an email that CMS, Center for Medicare and Medicare Services, have changed a regulation almost daily.
Really?
And the
regulations, the Medicare regulations are changing daily.
Virtually. It's not.
Yeah, I understand.
It's a given regulation. It's a given way they want us to, process paperwork, or the way they're going to reimburse us. It is a huge regulatory challenge for every healthcare provider, especially hospitals.
How many people do you have? People that's all they do is figure out how to comply with the Medicare regulations?
Well, we do, and most folks will have other jobs as well. But just staying on top of these regulatory changes and then changing our processes in the organization to adapt and comply is where the real challenge comes in.
Gotcha. Dave Ramsey, President and CEO of Charleston Area Medical Center. Dave, congratulations to you and your staff and all your people there on receiving that award from the U.S. Commerce Department of the Malcolm Baldrige National Quality Award. It's quite an achievement. Congratulations to you and your folks.
Well, thank you. We're very proud of that. One of the things in the the press release that the Chamber of Commerce put out, Commerce Department put out was that they commented that the Charleston Area Medical Center had a heart as big as West Virginia, and certainly I feel that way about our employees and everybody that's worked so hard to get us to this point.